Hey, what's up everybody? Dr. Strong here, and my mission is to help as many people as possible overcome their chronic health conditions so that they can have the highest quality of life as possible. And into this video today, what I want to do is I want to do something a little bit more unique. And what I want to do is I want to actually do like a mock interview or mock patient dialogue that I normally have with my patients on the first visit. So I'm just going to kind of go through and ask some questions. You can either write them down on a piece of paper, or you can just kind of keep a mental note as we kind of go through this. But when it comes to uncovering hidden or chronic health issues, there is kind of a sequence of events that I kind of go through with each patient in order to really identify exactly what's going on. So I just kind of want to walk you through those questions and then just kind of elaborate after each section, or kind of talk about what each question is really diving into so that you can understand what I'm assessing as we go through kind of like an initial exam and just like trying to find the root cause of the issue. And then at the end, we'll kind of talk about like how I put my thought process together about different organ systems, different body systems, and how they're correlating to each of your problems, which are primary, which are secondary, and just kind of give you like a case treatment plan afterwards. If you haven't already, go ahead and like and subscribe down below if you find my content useful. And then if you have any questions, just shoot them down below. More than happy. There's a lot of free resources below as well. There are some paid ones too, so I'm not trying to say that all my content is free. But there are books, there are courses, there are a multitude of things that you can get below. You can reach out to me with any questions. So let's kind of dive into it. So typically when I see patients, they've been to many other doctors and they're just not finding results. Most of the time they're struggling with gut issues, hormonal issues, they're struggling with fatigue, anxiety, depression, just a multitude of symptoms that most people have today that are, just kind of borderline ill, or they've been ill for a very long time. And this is the sequence that I use to kind of look. If you've seen any of my infographics or any of my other social media content, you'll know that we talk about the stress in our lives, and then how that affects the adrenals, and then how that affects the GI system, and then that affects our detoxification systems. And that's kind of like the order that we go through when we're going through this, in order to really dive in and say, hey, this is an adrenal problem, or we have a GI problem, or we have a liver detoxification problem. So let's go ahead and get started. So typically the first question I ask after people have given me their history and tell me what's going on is, okay, are you waking up nauseous in the morning? Are you having nausea first thing in the morning? And if you are, then a lot of times that can indicate that you have a cortisol issue. One of the best things to do is to eat within 30 minutes of waking up, so that you regulate that cortisol response and you get some stability in your blood sugar. You have glucose to get up and going, especially if you wake up feeling fatigued. That is kind of like a key indication or key sign. Another thing is intermittent fasting is really big, and I think that people can get a lot of benefit from fasting and doing the correct things, doing it correctly. But I think that there are still a lot of nuances that people don't know about. Like if you have like blood pressure issues, if you're having cortisol issues, if you're having a chronic brain fog or things like that, it can help with that. But also if you have instability in your blood sugar, it's not going to be good to fast up until the middle of every day, each day you're doing it. So that can really cause some problems later on. And you just want to be aware of that if you're not getting better. I recommend that people try at least 2 to 3 days a week to start. Do your intermittent fasting, and then you can do it, ramp it up later once you feel good, once you feel stable, you're eating enough calories. Make sure that you're eating enough calories if you're going to do intermittent fasting to kind of sustain you and to make sure that you have the energy to get throughout the rest of the day and recover like you need to. So intermittent fasting. Then the next question is, what does it look like around lunchtime? Are you crashing during lunchtime? Do you feel like you need a nap during lunchtime? If you do, that's kind of like another blood sugar indication sign as well. And then around 3 or 5, are you crashing during that time of the day? Do you feel like you just need to go take a nap and kind of get away? That can be also kind of another sign of diving into that adrenal dysfunction. The other thing is, do you binge eat at night? Do you eat the majority of your calories late at night at the end of the day? That can also be a sign that either you have like a food issue, like kind of like a food addiction, food problem, and then you're just like binge eating all of your calories all at once, and that can really upset the digestive process. And then if you're craving salty and sugary foods, like that is classic sign of adrenal fatigue, because adrenals produce, how we remember it at school is salt, sugar, and sex. So salt is blood pressure, sugar is glucocorticosteroid for glucose maintenance, and then sex is like your sex hormones, so testosterone, progesterone, and estrogen. So that's kind of like a general adrenal screening. We can dive in, like, are you chronically fatigued, trouble getting up in the morning, do you have trouble going to sleep, do you wake up throughout the night? Those are kind of like some additional questions that we can kind of throw in there as well. Then after that, we kind of dive into the GI system. And typical questions are, how often are you going to the bathroom each day? I've seen so many women now that they say that they're either going every 3 days or every 4 days or not even for a week. And you have to realize that that is a problem, because the easiest way to explain this is if you produce 3 bags of trash every day and you're only taking out 1, you're going to build up a lot of trash in your house. And now leaky gut, what that looks like is stabbing holes in that trash, and then it's just going everywhere. So the house is smelly, it's rotting, it's just not a good time for anybody, okay? So that's kind of like the first sign, like how's your bowel movements? Do you have any trouble with them? Are you going at least 1 to 2 times a day is kind of the normal. We want to be evacuating that. I see lateral lumbars, if you haven't seen my TikToks or other videos, you know that people are just full of poop and it's causing them to be toxic. So we definitely want to address that and make sure that that is not an issue, not causing more inflammation in the body. And then it's like, do you have any gas or bloating? If you have any gas or bloating, and then that can look like gut dysbiosis, that can be caused by leaky gut. That can look like, oh my gosh, maybe I feel like I've gained all this weight, but maybe you haven't. Maybe there is no adipose tissue, and we see that on lateral films all the time. That you actually don't have fat tissue, you just have bloating. You just have so much gas in your stomach that you probably have a 6-pack if you just got rid of the bloating. And like I said, a lot of times that occurs due to dysbiosis, which is just gut bacterial overgrowth that are producing certain gases in the stomach that cause it to expand. And then leaky gut, obviously that's just the breaking down. A lot of times that's tied back into the first system that we screen, which is adrenals, because you produce cortisol, and cortisol breaks down your stomach lining, causing leaky gut most of the time, is what we found and what research shows. Then after that, what we say is, there any blood in your stool? Do you have any blood in your urine? Anything like that going on? Those are just to rule out more severe type issues. And then, do you have heartburn? We got to rule out H. pylori or anything like that that could be causing more of an issue, that could be causing irritation to the esophagus, causing kind of like that GERD or heartburn type of issue going on. And then once we finish with that, do you have like an itchy anus? That can be an indication for parasites. If you do have an itchy anus, a lot of the times that is like a classic symptom, along with skin rashes, or typical parasites. Around 60% of the population actually has some sort of parasite in them at any given time, and so that can definitely cause a real big issue. So we definitely want to stay on top of that and make sure that we resolve that with a program. And then from there, like, do you have any trouble with certain foods? Do you notice certain foods bloat you, cause gas? Do you have a problem digesting certain foods? Are they coming out in your stool? How does your stool look? Or do you switch between constipation and diarrhea? That's another dysbiosis sort of thing. And just kind of looking at that. So GI system really doesn't take very long to kind of dive into, but it can give you a lot of good information about, okay, do we have like a leaky gut with some gut bacterial overgrowth? Do we have malabsorption and maldigestion? And then do we have like a more chronic or more severe bacterial infection like H. pylori that we need to address through like heartburn and those sorts of things? Do you get like abdominal cramping or pain at all either? Can be some really good questions to ask. And then kind of on the final side of looking at detox pathways, so that was the GI. Now we're going into the liver detoxification system. So my primary question for this is, do you have any skin rashes? Do you have skin itching? Do you have like any type of smelly armpits or anything like that? those are typical signs that your body's trying to detox. Because if the liver becomes overburdened, then what will happen is the skin will pick up because it's the secondary detoxification organ. So instead of trying to get them out through your bowels because you have a leaky gut or detoxify chemicals through the liver, they start coming through your skin. So you get like these red patches that can occur anywhere in the body. And then that can look like joint pain. If you're too toxic, then the joints will become kind of rusty, almost is the easiest way to think about it. Other things, are you sensitive to chemicals? Are you sensitive when you go out in public to, like car exhaustion, to perfumes? Are you sensitive to smells? And then do you have like any type of dry skin going on at all? Are you having like mood swings? That's more like on the neurotransmitter side of it. Do you suffer from depression? Fatigue is another one with that one. Anxiety can be a very big one with that one. And then is your hair falling out? A lot of your thyroid hormones are processed in your liver. So you actually convert metabolically inactive T4 to T3 in the liver. So with that being said, if your liver is overburdened, then your thyroid and even your sex hormones can suffer from that standpoint because there's just too much going on in the liver for them to process. And then with that, that's kind of like a good general view. Like typical thyroid symptoms are most of the time like a liver issue that ties into adrenals as well, because adrenals, cortisol will inhibit TSH and metabolically active T3. So that's where a lot of that comes into play as well. So that's kind of like the overall gist of kind of like how we kind of roll through it. I don't want this to go too long, but just if you answered yes to the majority of those questions, you can kind of see, okay, maybe I have some adrenal, but not so much GI, or maybe I have GI, but I don't really have adrenal. So maybe, I was stressed out at one point and I got like a parasitic infection. Or if you have them all, then it's like, okay, all my body systems that are used for optimal function are just kind of wiped out. And so we're just kind of diving deeper into that, like, hey, what do we need to do? So I know that's what everybody wants to know. And at this point in time, basically the best thing to do is like get on some adrenal adaptogens. It depending on like what stage of adrenal fatigue you're in. You would use different supplements, ashwagandha, rhodiola, licorice. You can use the mushrooms, the medicinal mushrooms are great. Lion's mane, chaga, reishi, all of those are great to support that system, support your immune response in the meantime. And then with the gut, just doing like a standard, I suggest you do like at least a 4 to 5 month pretty comprehensive gut program, because that's the only way that you're really going to know that you got rid of everything from parasites to bacteria to overall balance to sealing up your gut, because it takes time to heal those things. High doses of glutamine, marshmallow extract, chamomile, aloe vera extract. There's a lot of different simple supplements that you can use, along with more complicated protocols depending on what is actually going on. And then from the detox pathway, that one that is harder to just kind of guess at. Standard B vitamins are a good one. N-acetylcysteine. You can use glutathione, that's your major antioxidant in your body. But those are just some simple ways that you can kind of help with that stuff. I definitely advise that you work with a professional. And that's one of the reasons I make these videos. So if you want to work with me, you can understand my thought process and what we're going through and what we're doing. And it's not just an overnight quick fix. I definitely know that my clients get a lot better just throughout the course of their care, and just kind of following these protocols, changing up the diet, making sure we're cutting out inflammatory foods. So this has been a little drawn out, but hopefully it was helpful for you to understand kind of like the thought process that goes through with like a functional medicine practitioner versus somebody who's just going to give you a pill or say surgery or those sorts of things. But if you haven't already, please like and subscribe. I want to provide as much value to everybody who watches these videos, and comment below if you have any questions or if you have any topics that you would like me to cover. That helps me out immensely so that I know how I can best serve you. Like I said, you can check out my resources below. Some are free, some are not free. And then, yeah, so check out some of my other videos. I know that they'll be around here. Subscribe to the channel. And I hope you all have a great day. And please let me know if I can help you in any way. All right, guys. Have a great one. Bye-bye.